Of course, there's still some way to go. Now that phase one of the rollout has begun, concerns have been raised about who is going to get the jab, how it's going to be prioritised, especially during the first round of the rollout with just 80,000 doses available for the next 2 weeks. For more on this, I'm joined by Professor Umesh Lalloo, Principal Investigator at the Durban International Clinical Trials Group. Good evening, and thank you so much for your time. You are in private practice. Do you know when you and your colleagues will be vaccinated?
Thank you, Sally, and good evening to your viewers. At the moment, no, there's a bit of uncertainty, but we're certainly very excited about the development and looking forward to getting the vaccine. So we're looking forward to a lot of more clarity, because at the moment there's probably, as I would put it, misinformation about whether we're going to get it, whether it's going to be restricted to public or private sector, and also the other issue about whether certain groups such as the hospital association and other specialists and doctor groups need to lobby to get the vaccine. So we're awaiting clarity on that issue.
All right, well, I'd like to play a clip that we actually have from an interview done a little earlier with the Health Minister, Dr. Sally Burdett, and I actually asked him how the rollout is going to be prioritised between public and private hospitals. Let me just see if that clip is ready to play in right now. Let's see if we can take a listen.
Health workers that need to be vaccinated, and so we will make sure that we cover as many of them as possible, and I'm certain that the number is going to be increasing because of the enthusiasm that with which the vaccines have been received. So we are prioritizing health workers. Wherever they are, they need to be prioritized, and then after that we're going to focus on the frontline workers. There is a electronic vaccination data system that will actually indicate to people when they should come and get their vaccination. But we also combine that with anyone who walks into the vaccination center should be given attention to, because in any case at the moment this is the beginning. So we believe that health workers, whoever can reach the center, would be able to get there. Those will be invited to come over so that there's a reorganization of the vaccination program. We also will follow that.
All right, so that's the Health Minister explaining a little earlier, essentially that they are prioritising healthcare workers across public and private, and it's a matter of registering with the database. But furthermore, later in the interview, he did explain to me as well that it's not the health department that decides who gets it, it's also up to the hospital. So has there been any communication about how exactly it's going to work from the hospital you're associated with?
So, firstly, I think I appreciate the clarification. At the moment, we've not received any communication, and I think when that happens, that's when it leads to a lot of speculation. So we hope that, this would be an issue that is moving very fast, and we would hear from them soon. Just my commentary is that I think it's probably unfortunate that one has to rely on various groups to lobby for the vaccine. I think government has done a sterling job, made it available, and we just need clarity on what it means to say that hospitals need to apply. Where do they apply? How do they inform their staff? The information that we have at the moment is we were asked some days or weeks ago to register with our local hospital, the private hospitals, and so they have our information. So I hope that very quickly that would be communicated to the Department of Health or the MRC who's managing the current vaccine program, and we would get information on where and how when we will receive the vaccination.
So eNCA did speak to Dr. Anban Pillay this afternoon from the Health Department. What he told us is that private hospitals have agreed that for the first 2 weeks they will actually come to the public hospital vaccination sites. And then from week 3, private hospitals will receive training, start doing their own vaccinations. I would imagine you haven't been given that feedback as yet, but I understand that you've got some very clear ideas about which healthcare workers should be prioritised because you think they are more at risk. Just explain that to us.
So as a frontline worker, and just to give my background, I work as a pulmonologist and in critical care, and we've been working in the intensive care managing patients, and basically it's a very close contact with patients. So my view is that those are the categories of healthcare workers who should be vaccinated first, or at least early on in the strategy. And that includes nursing staff and allied staff that work in ICU. And over and above doctors like myself, I think the nursing staff who spend almost 12-hour shifts on close contact managing these patients should be top priority, because that's where the highest risk lies. So I think government, taking its advice from its scientific committee, from its medical advisory committee, would have worked this out and strategized, and given the limited supply of vaccines, that they would then stratify who should get it first. So we hope that that's what will happen, and I hope that a very clear communique will come out so that we are not allowed to speculate any further.
Yeah, you make an excellent point, and thank you very much for that we need clear lines of communication to avoid a sense that it's not being done fairly, but also to put people's mind at ease, because every day that hospital workers such as yourself are working with COVID-19 patients, you are, even though you're taking all precautions, exposing yourself to potential risk. And thank you for raising these really important issues at this time. That was Professor Umesh Lalloo from the Durban International Clinical Trials Group, saying that they still need more information at private hospitals as to exactly how the vaccination rollout is going to happen.